So, Harpreet, how are you doing now after 5 years of...
5 years, well, you can see the weight has still kept off.
Okay.
And,
how much is your weight now?
I just weighed it now. I think it's about 74 kilos, something like
74.
that. And it was originally 120.
120.
But most importantly, the diabetes has completely remained away. My HbA1c is around 5.
Oh, that's great.
It's
Even
very
after
good.
5 years after.
Yes.
Surgery, your HbA1c is 5.
5.
And
Which is what I had the surgery for. I was most worried about.
Yes, practically you got the surgery for the diabetes. And,
losing weight was a bonus.
Yeah, that's a bonus. Yeah.
Bonus.
But still, you are maintaining very good weight.
Yes,
like
yeah.
74, 75.
Yeah.
And I think there was some fluctuation in between. It went to 85 also.
Well, yes. After 2 years, you know, the major effect of eating a restriction, only small amounts, that disappears. So you just have to be a little wary that you need to keep.
We can say
you can't relax totally for the rest of your life.
Yeah.
You still need to be aware that if you don't maintain some discipline, the weight will come back on. Yeah.
So a little bit of maintenance is required.
Yes, for me, if I still have a love for chocolate, the operation cannot get rid of that. But if I overindulge, I can diet, and dieting is very easy because you never feel hunger.
Oh, so you mean to say that now, if you want to diet,
it's easy. I eat one time a day at 7 o'clock in the morning, my meal.
Okay.
Rest of the day, I don't eat.
Okay.
And the weight goes off very quickly, around 1 to 2 kilos a week. No hunger.
Okay.
And I'm in complete control of my body now. I am the master. I am the Maharaja.
So now you are the king.
I'm the king
of your body.
Yes. Before I was a slave. Most of these people are slaves. They cannot say no to indulgences. But now, even now, I can indulge because I know I can lose it. So if I do get a craving, a mini gastric bypass won't take away the cravings, but it takes away the hunger.
Oh, that's very important.
And that's 5 years, and it still hasn't diminished. So I can eat a meal at 7 o'clock in the morning, and the rest of the day, no problems. Weight goes off very quick.
So there has been a lot of research on this. Actually, the mini gastric bypass helps you for the peptide YY, the PYY, which is the key thing behind the hunger, and also the ghrelin. That's down. So
for me, that's the main beneficiary of the fact that for the rest of your life you don't have to worry about hunger.
Yeah.
Even now, I'm fasting for my blood tests. And I don't feel any problem.
You don't feel hungry. So that's one good thing about MGB and low HbA1c. You are maintaining low weight.
Yeah.
And what about any kind of generalized body weakness? What about the energy levels?
No, my energy level's always been good. I mean, I was hypothyroid, so but
energy levels is not a problem.
No, it's not.
If we talk about the volume of diet after 5 years, how much you can eat?
Well, I can eat a normal meal.
Okay.
I don't feel the need, but I mean, if my eyes, feast, I can eat a normal meal, no problem.
So that's further what I feel is good about mini gastric bypass, because the pouch is bigger.
Yeah.
Even in the beginning, although restriction is more, but still you can eat at least 3 times what the roux-en-y patient eats.
Yeah.
Their pouch is very small.
And there's no dumping syndrome or anything like that.
You didn't have any dumping?
No, never. I know you mentioned it in one of your videos, but I never felt any of that.
But
maybe it would have got in the sense that's good. It would have stopped me eating chocolate. So maybe
Yeah, because your habits are good. Maybe because of that you're not having dumping.
No.
Okay, that is good. So do you do some exercise?
Well, in Ludhiana I do, yes. I'm walking everywhere because the rickshaws won't stop for me for some reason.
But not in the UK.
In UK it's difficult. I try, the spirit is willing but the flesh is weak. But in a sense, I don't need to exercise because I can keep my weight under control. I realise exercise is important for general health and so forth.
For general health,
but I work shift work. It's difficult. I live in the middle of a major city, so we don't have easy opportunity. It's too dangerous to cycle, to bicycle.
Okay.
The roads are dangerous, so exercise.
What city you are in?
London.
London.
Yeah.
So you're living in
the centre of London, so it's not so easy to find a nice place to exercise. If you go in the park, the dogs chase after you and so forth.
So that.
When I retire, I shall go to a rural area and walk long.
Did you have bile reflux ever?
I had an ulcer about a year after the operation. I didn't really feel it. Well, I just felt a slight discomfort, and I came here, and it was solved. And for about a year afterwards, I was on proton pump inhibitors, PPIs, and omeprazole. But then it cleared up.
It cleared up.
It's cleared up, and no problem.
We have been doing endoscopy almost
But it's
every
important,
year.
and that's always clear. It's important to eat curds,
Yeah.
dahi 3 times a day.
So
if I don't,
yeah.
if I'm on a ketogenic diet, which I find easy to lose weight on, I'm not having curds, then I have a feeling, an empty feeling in the stomach, that I think I might be producing a little bit of excess acid.
Okay.
But
So
as soon as I eat normal food again, including the curds or dahi 3 times a day,
so you think the curd really helps?
I think that's the most important thing.
That's what we keep on telling all our patients, you need to take curd.
Yeah, and after the operation I didn't, and that's why, because in my country, we don't really take a lot of curds or dahi.
Yeah.
But now, I think that's the most important thing you can give advice to anyone.
Yes, it has
just
got
in case.
very good amount of calcium, then good proteins.
Yeah.
So curd is really good, and then it is anti-acid.
Yes, and I bought.
What about any vomiting or bile?
No, I never had anything like that. If I
irritation or
if I have a meal late at night, which is bad, and I might get a slight sensation of,
Okay.
So obviously, for anyone, good health, they should leave a 4 to 6 hour period of not eating near to going to sleep. So once I did that, there was no problem.
Okay.
But being a shift worker, occasionally I will work an evening, come home and have a big meal, and that's a no-no.
All right.
But that's not related. I think that's for anyone's good digestion.
You're taking your vitamins and iron regularly?
Yes, I did stop taking the iron, thinking I was eating normal food.
Yeah.
There's no problem. But yes, I did get slightly anemic, so I'm back on the iron.
Okay.
That's the only thing.
Coming back to iron now, the hemoglobin is better.
Yeah, it's normalised very quickly. Yeah.
Right.
So that's probably the most important thing after the operation. Dahi or curd 3 times a day, iron.
Good.
And calcium if necessary.
So you think it was a good trade-off?
Oh, it's wonderful, and I enjoy coming back to see you every year. And
we love you. We
and I love
you.
India.
Yeah,
so, through this I developed.
You are one of our best
India.
patients. You
well,
have
well, it's all
the
due
best
to you lot. It's nothing on my part. It's laziness that got me into the problem in the first place. But
at least now you're living without diabetes
yes,
and weight loss.
I can hopefully live a good retirement.
Good. All the best. Thank you very much.
Thank you for everything.